Knowing first aid is crucial. It empowers you to act quickly during emergencies. A timely response can make all the difference. You can potentially save a life. Imagine witnessing an accident or someone suddenly falling ill. It's natural to feel scared and helpless, but with basic first aid knowledge, you can overcome those feelings. You can provide immediate assistance before professional help arrives. First aid is not just about treating injuries, it's about being prepared. Keep a well-stocked first aid kit at home, in your car, and even at work. Familiarize yourself with its contents and how to use them. You never know when you might need it. Remember, even basic first aid can make a significant difference. By taking a few simple steps, you can alleviate pain, prevent further injury, and even save a life. Be prepared and be the difference. Before rushing to help, take a moment to assess the situation. Your safety and the safety of others come first. Check for any potential dangers. Is there fire, smoke, or hazardous materials? If the scene is unsafe, do not put yourself at risk. Call 911 or your local emergency number immediately. Provide clear and concise information about the location and nature of the emergency. Once you've ensured the scene is safe, approach the injured person. Check if they are responsive. Gently tap their shoulder and ask, "Are you okay?" If they are conscious, introduce yourself and ask for permission to help. Remember, a calm and collected approach is essential. Your composure can help reassure the injured person and those around you. Take charge of the situation, but always prioritize safety. In any emergency situation, it's vital to remain calm. Panicking can hinder your ability to think clearly and act effectively. Take a deep breath and assess the situation. Follow the 3 C's: check, call, and care. Check the scene and the injured person. Call 911 or your local emergency number for professional medical help. Then, provide care according to your first aid training. For unconscious individuals, check their airway, breathing, and circulation ABCs. If someone is not breathing, start CPR immediately. For conscious victims, address any life-threatening injuries first, such as severe bleeding. Remember, the first few minutes after an injury are critical. Your quick thinking and decisive actions can make a significant difference in the outcome. Choking and cardiac arrest are life-threatening emergencies requiring immediate action. Knowing how to respond can be the difference between life and death. If someone is choking, perform the Heimlich maneuver. Stand behind them, wrap your arms around their waist and make a fist with one hand. Place the thumb side of your fist just above their navel and below the rib cage. Grasp your fist with your other hand and give quick upward thrusts into their abdomen until the object is dislodged. If someone is unconscious and not breathing, call 911 and begin CPR. Push hard and fast in the center of their chest, allowing the chest to fully recoil between compressions. If trained, give 2 rescue breaths after every 30 compressions. Learning CPR is easier than you think. Sign up for a CPR certification course today. It's a skill that could save a life, maybe even the life of someone you love. Section 5. Stop the bleeding, control and dress wounds. Bleeding is a common injury that can range from minor cuts to severe wounds. It's crucial to control bleeding promptly to prevent excessive blood loss. Apply direct pressure to the wound using a clean cloth or sterile dressing. If blood soaks through, don't remove it. Add more layers on top. Elevate the injured limb above the heart level if possible. For severe bleeding, maintain pressure until medical help arrives. If there is an embedded object, do not remove it. Apply pressure around the object to control bleeding. Once the bleeding is under control, cover the wound with a clean dressing and secure it with a bandage. Seek medical attention for any wound that is deep, heavily bleeding, or shows signs of infection. Section 6. Burns types and immediate treatments. Burns are classified by severity from 1st degree to 3rd degree with different treatments for each. Recognizing the type of burn is crucial for proper first aid. 1st degree burns affect only the outer layer of skin, causing redness and pain. Run cool water over the burn for several minutes. Apply a cool compress and over-the-counter pain relievers if needed. 2nd degree burns involve deeper layers of skin characterized by blisters and intense pain. Cool the burn with cool water, but do not break blisters. Cover loosely with a sterile, non-stick dressing. 3rd degree burns are the most severe, affecting all skin layers and underlying tissues. They appear white or charred. Call 911 immediately. Cover the burn with a clean, dry cloth. Do not apply ointments or immerse in water. Remember, never use ice directly on burns as it can further damage the tissue. For any burn larger than 3 inches or on the face, hands, feet or genitals, seek immediate medical attention. Section 7. Call for help. When and what to tell emergency services. Knowing when and how to call for help is essential in any emergency. Your call can initiate a swift response from medical professionals, potentially saving a life. Dial 911 or your local emergency number immediately if you encounter a life-threatening situation. These include unconsciousness, difficulty breathing, severe bleeding, chest pain, or a suspected heart attack. When you call, stay calm and provide clear and concise information. Clearly state your location, the nature of the emergency, and the number of people involved. Answer the dispatcher's questions accurately and follow their instructions. Do not hang up the phone until the dispatcher tells you to. They may provide further instructions or guide you through first aid procedures while help is on the way. Remember, even if you're unsure about the severity of the situation, it's always better to err on the side of caution and call for help. Section 8. Be ready, be confident, first aid training for everyone. Knowing first aid is an invaluable life skill that empowers you to act confidently during emergencies. It equips you with the knowledge and skills to provide immediate care, potentially making a life-saving difference. Enroll in a certified first aid and CPR course. These courses offer comprehensive training on various aspects of first aid, including wound care, fracture management, and handling medical emergencies. You'll learn how to assess situations, provide appropriate care, and use essential first aid equipment. Regular practice and refresher courses are crucial to maintain your skills and knowledge. Consider taking a course with family and friends to ensure everyone in your circle is prepared. Remember, being first aid certified not only benefits you, but also those around you. You become a valuable asset in your community, workplace, and even during everyday activities.